It's interesting how each state does things differently. Georgia started to get back to business on April 24th, but North Carolina didn't start reopening its economy until last week. And most of the things that we reopened first, like nail salons and hairdressers, North Carolina has decided can wait. Georgia and North Carolina have roughly the same population, about 10.5 million. Georgia ordered everyone to shelter in place on April 3rd, 4 days after North Carolina. But on that day, North Carolina was ahead of us on testing, but had fewer COVID-19 cases, 2,093. Georgia had double the number and 9 times more deaths. Fast forward to this past Thursday. North Carolina reported more than 16,000 laboratory confirmed cases, still half of Georgia's total. But Georgia has picked up the testing, especially in the past 2 weeks, averaging 8,394 tests per day. Both states want to flatten the curve to avoid overwhelming the hospitals. Because Georgia didn't start tracking the number of patients actually in the hospital each day until May, we only have the past 2 weeks to compare. In that time, North Carolina has consistently had about a third the number of patients, their highest day of hospitalization throughout the pandemic, April 29th, when they reported 551 patients. The good news for Georgia is that our number is trending down, despite removing the shelter-in-place order for all but the elderly and medically fragile. So why has Georgia been hit harder? We're still working on that answer, but a big reason is likely when the virus entered our community. Georgia and North Carolina announced their first positive cases within a day of each other in early March. But Georgia has since tracked positive cases in our state back to February 1st. That means COVID-19 spread undetected for more than a month in our community.